Talk 100.3 Ramadan Kareem. Now, can pregnant women fast during pregnancy? इस विषय पे बात करने के लिए डॉक्टर मुनीमा हबीब हमारे साथ, Obstetrics and Gynecology, Women Care at Prime Hospital. Dr. Munima, a pleasure to speak to you this morning. Good morning and Ramadan Kareem.
Good morning, dear. Thank you so much for inviting me for the talk.
It is our pleasure, and we really wanted to know about this subject, this topic. Is fasting safe during pregnancy?
Before I answer this question, let me emphasize that Islam gives permission to pregnant women to opt out of fasting. The missed days of fasting, they can be made up at a later date, or fidya can be paid by providing food to someone in need for every missed day of fasting. As far as safety of fasting during pregnancy is concerned, the research is still going on in this area. The evidence is conflicting. Some studies have shown that babies born to mothers who were fasting, they were slightly smaller than those of who weren't fasting. But then other studies showed that there was no difference at all.
So, there is a contradiction
yes,
of those studies as
well.
There's
a contradiction. So, but the impact of fasting would also depend on the gestational stage of pregnancy and also on her overall health.
So, there is no clear-cut answer for this. Is fasting safe, during pregnancy?
We do not stop ladies from fasting during pregnancy. The decision is a personal one. But one thing is for sure that there is an increased risk of dehydration and excessive fatigue from prolonged fasting. That is for sure. And we don't usually stop pregnant ladies from fasting. All pregnant ladies we don't stop, but there are ladies who might have a history of preterm birth or bad obstetric history previously, or who have a history of renal stones, or ladies who are malnourished or who have peptic ulcer disease. They should refrain from fasting. Or if there is diabetes during pregnancy, who need to take small frequent meals to keep their sugar levels under control, they should refrain from fasting. So overall, these are the patients, but we don't usually stop all pregnant ladies from fasting.
Right, and it's always good to take professional help. Now, Dr. Munima, what are the parameters a pregnant woman must be mindful of?
In case the lady decides to fast during pregnancy, for sure she should stay properly hydrated during the non-fasting hours, and she should watch out for any signs of dehydration, like feeling very thirsty or passing small quantity of very dark colored urine, or if she has headache, dizziness, nausea, vomiting, any of these symptoms, if the lady has, she should immediately break her fast and consult her doctor. Then she should rest as much as possible, and she should not overexert herself. This is very important. And prioritize adequate sleep. This is also very important because we do have those nighttime prayers during Ramadan. So there is no need to go overboard with your prayers. You will have many, many more Ramadans to make up for the missed prayers later on. And it's very important to be aware of any reduction or change in baby movements while you're fasting. And if there is any thing like that, you should immediately contact your doctor.
राइट डॉक्टर मुनीमा, आपने थोड़ी देर पहले कहा भी था कि फास्टिंग के इफेक्ट स्टडी भी हुई है उस पे, लेकिन फीटस पे कुछ एडवर्स इफेक्ट होते हैं इससे फास्टिंग के वजह से?
कुछ स्टडीज ने बताया है कि मतलब द बेबीज माइट बी स्मॉलर देन द लेडीज हु डिड नॉट फास्ट. कुछ स्टडीज में पता चला है, स्पेशली अगर फर्स्ट ट्राइमेस्टर में फास्ट करें, बट द स्टडीज आर सो कॉन्फ्लिक्टिंग दैट वी डू नॉट यूजुअली कमेंट ऑन इट. वी नीड लाइक मोर वेल डिजाइन्ड स्टडीज टू स्टडी द फुल इम्पैक्ट ऑफ रमजान ऑन फीटस एंड द मैटरनल हेल्थ.
राइट, तो क्या डूज और डोंट्स या प्रोटोकॉल्स है प्रेग्नेंट वुमेन के लिए ताकि वो सेफली फास्ट कर सके? बिकॉज आपने कहा कि एक पर्सनल डिसीजन है, आप ले सकते हो एज ए प्रेग्नेंट वुमेन अगर आपको फास्ट करना.
जी, अंडर क्लोज सुपरविजन फ्रॉम योर ऑब्स्टेट्रिशियन फॉर श्योर दे कैन फास्ट.
राइट,
एंड मैंने एंड आई ऑलरेडी टोल्ड यू द पीपल हु शुड नॉट फास्ट, जिनमें हम क्लियर कट बोलते हैं कि नो, लाइक यू शुड नॉट फास्ट एट ऑल, जो मैंने ऑलरेडी मेंशन की है.
राइट. And anything in particular, because the other day, we got this message कि उनके घर पे newborn baby है, तो sleep is a big issue for them. और also रमजान के टाइम पे आपने mention किया sleep. So how sleep is extremely important for pregnant women and for everyone in general.
Because if the person is not sleeping well, of course they will feel more fatigue, and fatigue can lead to irritability and everything else. You need to rest well during pregnancy for sure to have that sense of well-being. This is very important.
Right. And for all the couples who are planning a baby, उनके लिए कुछ कहना हो, and also for mummies who have newborn babies, अगर उनके लिए भी कुछ tips देने हो तो.
सबसे पहले जो आपने मुझे स्टेप्स डूज एंड डू नॉट्स पूछे थे, मैं जरा उसको क्विकली आपको बता दूं कि प्रेग्नेंट लेडीज हु आर प्लानिंग टू फास्ट ड्यूरिंग प्रेगनेंसी, दे शुड ऑलवेज वेक अप फॉर सहूर, द प्री सनराइज मील, which is they should take foods which have high water and fiber content like fruits, vegetables, फिर whole meal foods हो गए, whole meal grains जो होते हैं, then proteins which can be either vegetarian or non-vegetarian source depending on your preference, nuts, milk, yogurt, laban हो गया. But they should avoid heavily salted and processed foods. This is very important. It will make them feel more dehydrated. Then avoid spicy foods to prevent any acidity or heartburn, or caffeinated drinks avoid करनी चाहिए because they are like diuretics and they make you more dehydrated. Or one thing more important is that at time of iftar, do not immediately take lot of sugary stuff. हमारे पास बहुत सारा वो मीठा वो होता है available at time of iftar. So try to open your fast with dates and fruits.
Super.
And then they can follow with slow release foods like whole grain foods or proteins. And of course, drink lots of fluids to stay well hydrated.
Fantastic. And now a tip for couples who are looking to be new parents. उनके लिए कुछ tip?
Just pre-pregnancy health is very important. You need to start eating healthy from the beginning, and they should start taking their folic acid. We are usually starting them on folic acid, and it's very important to be in the normal BMI to have a healthy pregnancy without complications. This is very important. Usually when we have new couples coming to us planning for a baby, so first tip we give them is to eat healthy and have a regular exercise schedule. So it makes a difference. Like the pregnancy is much easier for patients who are in the normal BMI.
Superb. And for parents who are blessed with a newborn child?
Same thing. They should eat a well-balanced, nutritious diet. In addition to the taking care of the baby, they should also prioritize rest somehow. So it's a mutual thing between the couples. So when the lady is tired, the father should take care of the baby for some time so that she's able to rest.
Right.
And
this is so important, Dr. Munima, to keep
exactly. जी. और प्रेग्नेंट लेडीज के लिए जो आपने मुझे वो फास्टिंग का बोला था, तो I would just say that since there's a provision in Islam for you to opt out, consider to fast on some but not all days of the month to make it more manageable. That would be much better. We don't stop from fasting, but at least it should not be like every day. So they can fast on certain days and they can opt out on certain days. It will be much easier and smoother for them that way.
Right. And also, अगर आप फास्ट करने का सोच रहे हो, if you are pregnant, then you should always seek professional help. And Dr. Munima Habib
for sure.
is at Prime Medical Center, Al Barari.
जी.
And people can book appointments over there?
Yes, for sure. They can book an appointment with me there, and of course, I can guide them.
Superb. Dr. Munima, Ramadan Kareeb, thank you so much for the amazing insights जो आपने share किया है. Not only for women, for all the men out there as well, to understand a woman better.
Yeah, thank you so much, Michael.
Thank you.
Thank you.